because our aim is not to use this as an example and believe. The problem is because there's no documentation. You told me, I understood it, very good. There is no consistent documentation of all the patients who come to the hospital. Then there is a consistent documentation.
We need to extrapolate this and get more information on patients who have.
Suppose I tell it, that does not mean that another astrologer can tell this.
No.
There is nothing. It's a question of a skill of conglomeration of all the information at a point, pocket of point. It's the ability of a person to read it. That's all.
It is like how doctors do ultrasound or how people interpret clinical science.
No, I understand. And even if we prove it, that he can do it and nobody else can, or somebody else with the same mindset can, that's a second level of the process. He has done great work, and he's probably like you, he's told many people about the thing, and 99% maybe, that's hypothetically saying it's true. There is no documentation, and that is what I think would be very helpful to prove astrology as a science, even though he may be one of them who can do it and hardly anybody else can. That is a second.
That was what I was telling Shashi, to take the stroke patients, we know the exact time when they had the stroke. So if we can get the time and place of birth and give it to Ramesh,
right.
If we can look into that and see a pattern, okay, then we can say, okay, these are the patterns and who have developed strokes at this point of their lives. Okay, so it's stroke is which is like your time of birth, it is like as accurate as that. So you can always look at people, those who have risk factors for developing stroke, run their horoscopes into softwares and see if they are going to develop stroke or not.
Yeah, same thing.
Yeah, so that's what he's going to probably do if he gets some time.
So we can do the retrospective study.
That's what
Retrospective study of patients who have undergone the surgeries. We can take the
time. Surgery means patients may improve or no.
Yeah.
So they can have complications.
We can take the time.
If you take stroke, it's a definite.
Yeah.
Stroke. No, suppose we take hemiplegia. It's a definite major insult in their life. Okay, and you can exactly pinpoint the time and date exactly. Every patient will remember. They said I was walking on the road and I had a stroke. So we are very sure about the time when it has developed. Okay, and we have database of so many patients who have had strokes. We have the time. Retrospectively we can analyze. Even if we record 100 patients, if we get a lot of information.
At the beginning, my mindset was more than what you are saying. My mindset is any disease. Your mindset is very good because you're a neurologist and it's a very good mindset to start the process. But that is one aspect that is wonderful. Seeing with stroke people we can do it. But doctors would say, okay, what about diabetics? What about hypertensives? So if you do in general hospitals, you can use this as a start. It would be a great thing to at least have a beginning of the nidus of the process. But if you can do it, because you being a neurologist, I'm saying if it was brought in all the hospitals, then if you can predict it, then astrology as a true science will become far more emphatic.
Exactly.
That's what I think is helpful to do. And the next process is is there a you told him not to eat anything. You gave him
ask him not to eat oil.
Just look at it, don't eat.
Yesterday I come to check him for his birth capacity. Hardly put say Rama for only 5 to 6 points.
Very good.
Yeah, right. Just come to check to the stand. Let's check
It's not. You think it is. If you're doing it in the other hospital, no words. No, people are coming in a hospital like this. It's no huge work. It's all database. You make it a huge work, then you can yes.
already physically good. You
I did it yesterday.
can do it once again.
Please, let him do it.
Here, Sudhir. Here, Sudhir. Here.
Doesn't matter, don't matter. Easy thing, don't worry, it's okay. I did it, it was very low, it was 10 seconds. You already did, you want to do
See,
it.
so same thing can be done in a peak flow.
Yeah, big flow, same thing.
So if we can small study,
Yeah,
in
yeah.
whatever he has told, we can think of at least 30 hypothetical research papers.
No, what we need to do it in a manner which is more systematic rather than 30 papers.
5 years.
So you could be able to do it far better because you have those resources.
So, yeah, it's
How many does your go? 30 years.
and you can improve it.
Yeah, you have to practice. You have to practice.
And that's what he's talking about is, you know, if you increase the oxygenation, if you increase the lung capacity, then 99% most of the diseases won't happen. You know,
Yeah.
that's the context. And it may or may not be necessarily always the truth, but that's what his prediction is or mindset. If it's good,
Yeah, unless there is a karmic deed intervention, if it is a mind psychosomatic disease or that, this works wonderful. If it is a karmic deed working out, then it not be more having more oxygen also it can generate a disease. Psychosomatism.
psychosomatic it is working very well.
Well, this is an order.
So this is really for mental disorders, more predictability than physical disorders.
And yoga science we say breathing is a mahaprana, for the 5 pranas. Udana is upward, apana is a downward, samana is a digestive force, balancing.
Right.
Mahaprana is a breathing, and vyana, body sensation is a vyana. So focusing on mahaprana is a bit option. Very good. According to integrative medicine, where you say Ayurveda, yoga, and nutrition science, if you focus in such a way that increase the mahaprana working on regular frequency of breathing in, holding, breathing out, breathing in, holding, breathing in certain patterns. What I use is I use some mudras. Mudras followed by 4 seconds breathing in, 4 seconds holding the breath, 4 seconds breathing. Then 4-4-4 I call it as 1. 4-4-4 I call it as 1. And sharing more prana. 4-4-4 I say it as 1. And if somebody is focusing, if their mind is quality of mind is to wander. If I make it wander only in breathing in, holding, breathing out for a certain duration, say for example 4-4-4 as a 1 I'll say, like that I'll ask them to do 20 times morning, 20 times evening for first 1 minute. So they are giving a regular breaks of less thought state or no thought state in a regular period. Number of thoughts are reduced. Next month I'll ask them 6-4-6, 20 morning, 30 evening for next second month. Third month almost 6-6-6 for 3 months to 6 months. So regularly I'm breaking my first thought. But I want to make it feel this one as a Sri thing. Sudarshan Kriya, something like that. We want to make it a Shashikant integrated thing. Sudarshan Kriya. See, this is to.
You need to wear that. That is important.
So what I mean to say is we can integratively with different streams of medicine and different specialty and different areas. We can definitely keep. My motive of saying this is to.
So my time is, you could say that the child should have a problem in the head, right?
So,
That is a very valid prediction. In fact,
no,
you
absolutely.
will find out.
I agree, absolutely.
It also says that the thought of not having consumption at that time. There was a system, let me not have a consumption at present. This was the idea. There was with the resistance.
No, sir.
Some one of the
Maybe that could have been good. But I tell you, this conception was after 5.5 years. We did lot of pariharas and all those things, and pujas and other things for the pregnancy.
And you are having Rahu and Mars. So the moment you pick up the properties, the dosha starts. For your husband. The moment you pick up the property, dosha starts for the mother also. When mother also get the problem when there was the house construction happens in Iyer. It's also indicated in your house. She also picked up the problem. That means, for some reason, you should be a universal man. You should work for the universe, not for the self located area, small area. That's the meaning of it. You become holistic, the disease does not touch you.
Very difficult to become holistic.
We are already into holistic.
He knows that.
We all start thinking about money, we all start thinking about children,
What I want to tell you is, see, intelligence is the focal things of the cream of the intelligent people. But cosmic intelligence is to very high degree.
Yes.
All the factors you cannot bring to the one focal of things. It works at the, even I have not mentioned you, there are other factors to be looked into the disease, not only this alone. See here,
These two, or this four, what sir is mainly trying to do is capture this particular essence of intelligence of yours or cosmic intelligence and try to build some metaphysical instrument where it can do
we
the same.
openly donate all our knowledge.
Yeah.
We don't hide this because we are also working for the same thing. My intention of introducing the astromedicine is only to the world that it is a parameter of the higher order is always working on us so that go in a dharma. To go in a dharmic way, knowingly or unknowingly, if any error happens, there is also you are bringing out a adulterated condensation of the energy forces which will cause a disease. There is a suffering world comes into you because of the wrong reading of the nature. Like when you read the rope into snake, the steroid immediately shoots up inside because of the wrong reading. So wrong reading has to be first proper. Not good reading, right reading. Wrong reading should not be. So that's the motivation of this astronomy. So because the Einstein has done a matter energy, Newton is worked on matter energy, but this is a conscious domain, conscious science. It is higher than the Einstein actually. Astromedicine is higher than the because the intelligence cannot capture it. That's the thing. It's only a subjectively working out, but at the very subtle level, it's working on the matter. Metaphysically, it's working out.
But what we could do is, because you are trying to get into a very good knowledge to help the process, even though we say that we cannot understand everything, even if we understand 10%, 5%, at least that knowledge can be spread to the world in a common sense, even though you may have, because suppose when you are dead, like I am dead, that knowledge is going to be stopped there. I don't think it's a good thing.
Yeah, what you are telling is the same motivation of mine also. That's why I did the experimental study for this.
Yes, yes.
As a veterinarian, for having going to a yoga university,
Yes.
I took the dimension of this. Only to show that the world, there are higher orders are working still with the medical science. Now we require more windows to be open on that. You can have some.
Do you think this kind of meetings also is prearranged or hospital?
And my way of looking at it, I don't plan anything else. When the plan people, plan forces are coming to me, I extend it to them.
Yeah, I know you are very good and that's teaching. That's the key.
I have one question towards you. If, for example, one particular patient will use, for example, for myself or somebody else will use.
Right.
See, as yesterday I seen a evaluation class on very official. We do all the detailed evaluation of the medical histopathology and all those physical examination questionnaires like qualitative type evaluation. And then you do the evaluation in terms of the specific fields of medicine which have been chosen and which have been incorporated into that particular software. So after that, how or what exact solutions you are giving in terms of, say for example, a terminal cancer, or my mother is alive, somebody is having some other issue,
Right.
how effectively you are incorporating these different techniques in a way that the person is getting a more evidence-based therapies. Unlike if I go to some, for example, when one of the cancer, you will say change the diet, make it more alkaline. Somebody is providing more of alkaline diet, less sweet, less spice, and all that. How to validate and approve that this person is doing right and we can adopt, say this person is providing a better diet, variation, this other person is providing sugar, better. How to
We
validate?
can't rent the time as you said, 3 p.m. is not my time.
Immediately my mind reads it. There should be always correlation of the time runs with some minutes. You cannot give it round figure.
Per minute.
What he was asking.
Hardly once, 1 in 1,000 or 1 in 10,000, that type of time.
Maybe what I feel what he's asking.
What he feels is yours is not an accurate time, it's an approximation.
Yes.
No, as per my,
Suppose it is approximation. What I was trying to do, because yesterday we were doing for me, and I gave him the time period of 6:50 p.m. Example. Okay. Then he did his calculations, and calculations he said that around the age of 7 or 17, I don't remember, but you would have changed your residence. And then the few things he said. So I told him, no, I never changed my residence. I actually stayed, born in the same house, stayed in the same house till I was 23 and a half. When it became, after finishing my MBBS, I left for England. I remained in the same house. So then we were trying to say, he was trying to calculate that would happen. Because my time I had given him was 6:50 p.m. Then he was making it 7:05. We were playing with it. Because we know that's when I really work. So then we can go back retrospectively and then say the real time of birth most likely of yours was not 6:50, was whatever.
Little variation.
No, but then he could do it. Then other thing, I had a major surgery.
Any property, any assets, everything goes with the second attack. That becomes a fine. School joining and living, shifting other things, going to college, shifting, going to job, shifting, going to profession, shifting, seeking the seat, shifting, and marrying the girl, also shifting. Everything he finds an alteration. The alteration happens with the people. What does not go for alteration, that's a problem. What does not go for alteration, that's a problem. Shifted, second choice is created. Wonderful. Made a house also. Made a house. Taking out of it is a good actually. And dispose the house.
I already told them, so some girl committed suicide, you cannot able to sell it off. I thought, what's the last price of selling it?
So if not sell it out, you drop it and come back. The dropping is also as good as the selling it. But you are holding it is the one which links to.
I made a 25 years and every medical expert every got it. Very
You should always be in a rented house.
You get better also rented and you won't have any attachment also.
That's why it works on your brother also. Brother also rented. Same person which is working on that order is also working on that.
Others and family son, yes,
It's all working on the same time. That's what I'm working. That's why if he also does not purchase the property, he also recovers. He is also with the property also. Because Mars will develop. Mars is a carbon. Carbon is one which builds the personality. Carbon, one on which the muscular tissues, muscular systems builds up.
And this is also a head of the medication, but it's on this head.
Oh, you talk to this one, I say.
Yes.
Which is your native place?
Delhi.
Oh.
That's why. I spoke Sanskrit. I mean, I'm not Sanskrit. I learned Sanskrit, so it's good. So, let's, just to play with it, let's do my, let's see, after we figure out what it was yesterday we were dying, let's see if we can figure the exact time, just because he gave me the exact time. You could predict very precisely. Right, so maybe like you were doing mine, maybe
And even another paragraph also, whatever he studies right in the exam, he always misses the right point while writing the exam, and before submitting the paper, he adds up and gives. This is also his habit of in college days. One important point is he always adds up to the written paper and finally adds up in small things, corrects it.
That I used to do. That I used to do. After writing the answer,
That's
something
all.
was not there.
You get immediate
I
flash
used
at
to
the end.
read everything.
You get immediate flash at the end.
Then I had something, 1 or 2 lines of the level.
Always
Or put an arrow in between and add it.
This is your nature. This is also the nature.
And multiple choice questions I want. Very much change it.
Same the A, B, C, D and all these things.
But this most children would do.
You get conquered, the rightness, right comes to you.
Oh, okay, okay.
You are taking a second attempt brings the righteousness. And it is never wrong. It is never wrong.
Yeah.
This is how your mind behaves.
he's saying next
Okay,
time
okay,
the
okay.
test, you should do the last one. Don't do it. Is this the first time we do this?
Even when judging the patient,
Yeah.
while judging the patient, even while judging the patient also, what description you describe, at the end, you scratch one thing and add up one thing. That becomes the goal.
That happens not in many prescriptions, but when we write 3 or 4 drugs, then that happens. I might cut and write something else. Or after writing a prescription, then I might add 1 more drug to that. After signing, I put 1 more medicine.
This
He
is
said that drug is the most important.
Probably that might go.
That's a blissful
The
drug.
rest of the drugs are not important.
Okay.
And that's what I'm seeing from it.
That means your horoscope is designed in such a way that what you do in a second attempt brings the graciousness.
So you could cancel all the other drugs.
If not cancel, addition.
Yeah, probably I should do that, right? 2 or 3 medicines and then
Not intentionally.
sign it off. Yeah, it doesn't happen intentionally. I say, what I do is I write the prescription, then I put an underline, then I put my sign.
Because then your mind says, oh, we should add this.
Okay, and then when I start explaining the medicine to the patient, then I say, oh, something is left out. Let me add that.
That's what he's talking about.
That happens.
Yeah, but I mean, that happens to all of us. But he says when that happens to you.
That works well for the patient.
Yes. If I do it, it may not work, but that's what he's trying to say. Makes interesting
By
sense.
using your all intelligence, at that time you cannot write the prescription properly.
It may not work for the patient. If I write 1 medicine, it will not work.
A single time you cannot write, finish it and you cannot give it. It cannot happen. It has to come back and get the recorrection. That becomes the boon life.
And sometimes it happens that patient will come and say, sir, this medicine is not available. Give me another prescription. Let give another drug. Or at least change the company and give.
See, now what I could see is there is a Saturn Dasha is going on. Saturn Dasha is going on. Saturn is actually a 6th lord sitting in the means 8th is actually sitting in the brain. And the point of focusing is on the oculomotor area. One is oculomotor area. Another is obducens area. These are the 2 places where the obducens nerve as well as the oculomotor nerve is also involved. Nearer to these points are actually getting together. Any patients we handle, these are the foci of the errorful areas. This is what I could see in the hospital. And ask the patient to take a change in the location if there is a problem for it. That also means I am what house they located. Ask them to take another change for some days. They recover. And soon always there will be a house cause is also there for all the patients that you treat.
Okay, so it is interlinked. The clinic goes on.
All the patient you treat is also having the cause of the house. You get verified. It's a non-person.
So what a crazy doctor if you tell him the house becomes making.
But I'll tell you one example. There was one very tough patient. This fellow had jumped from the 4th floor of his building into the swimming pool. This fellow had seizures, would refuse to take medicines. And he has gone through a lot of psychiatric counseling and parents would come and weep. And finally asked Shashikant to take them to Ramesh and see if he can do something more than what doctors can do. So he told them to, he saw all their things and then he told them to drop their house. They sold off their house, they moved out. Now this boy is doing good. This fellow wanted to become a bike racer in that circus and you know that this one is very, and this fellow is an epileptic, he's not supposed to try. So now this fellow has got back to his senses, he's taking his medicines regularly. He has finished his test just by dropping their house.
But he's taking the medicine.
He's taking the medicine regularly, yes. Because before that, you take one tablet once in a week, valproic acid.
So now he's taking it regularly.
Compliance is there, his quality of life is good. He has quit his, that ganja or something he was taking, that I came to know only a few months ago. He stopped that. The quality of life was tremendously changed. I was telling Arjun sex something.